Hello friends, my name is Dr. Dikshit. I am heading Department of Hematology and Bone Marrow Transplant in Artemis Hospital, Gurgaon. My department deals with blood cancers, bone marrow transplant and CAR T-cell therapy. Today we will talk about a very important topic which is called as bone marrow transplant. So first we will talk about what exactly is bone marrow transplant. Bone marrow transplant is a medical procedure in which we replace a diseased bone marrow by a normal bone marrow. It can be broadly of two types. First type is allogeneic transplant, in which we replace patient's bone marrow by healthy bone marrow from a donor. So it requires a donor. Second type of transplant is autologous transplant, in which patient himself is the donor and patient is the recipient. So there are fixed indications in which we are doing allogeneic transplant, and there are other indications in which we offer autologous transplant. So first we will talk about allogeneic transplant, and there are basically further of three types. First is matched sibling transplant, in which patient's sister or brother is the donor. We always prefer full matched donor because that gives us best results. Second type of allogeneic transplant is called as half matched or haploidentical transplant. So in which we take half matched donors as the donors for the transplant, because all patients they don't have full matched donor. So if patient doesn't have donor, we are left with half matched donor, or we have to search for donors from the registry, which is called as matched unrelated donor transplant. So these are the three broad types of transplant depending upon the type of donor, and we always prefer to do full match, whether it is from the family or it is from the registry. Now talking about the indication of allogeneic transplant, there are two types of disease in blood. One type is the cancer. It includes blood cancers like ALL, AML, MDS, and basically transplant is done at all the stages in AML, and most of the patients who have AML or acute myeloid leukemia, they require bone marrow transplant. If we do it earlier, results are better. If we do it at later stage, results are not so optimal, but still sometimes we have to do it. Other indications like ALL, acute lymphoblastic leukemia, is also treated with allogeneic transplant. Usually ALL is a very good cancer in the sense that it responds well to chemotherapy. However, patients who are not responding to chemotherapy, they require BMT. Then there are other cancers like MDS or lymphomas, then myelomas, who require allogeneic transplant in few cases. The second part of blood disease is a non-cancerous disease, which includes sickle cell disease, which includes thalassemia, and bone marrow transplant is the only way to cure sickle cell disease and thalassemia as of now. Going forward, we may have more therapies like gene therapies and other therapies, but as of now, bone marrow transplant is the only way to cure. And what we do is we take a good donor, we transmit those cells in the patient and replace marrow by a normal marrow. So these are the indications and the types of allogeneic bone marrow transplant. In case you have any other queries or you want to ask any questions, please feel free to contact Cure India. Thank you.
لو تريد العلاج في الهند لا تنسوا الإعجاب في الفيديو والاشتراك بالقناة ليصلكم كل جديد من كيور إنديا.